All right, so we're gonna go ahead and do bed to wheelchair skill. So before we go ahead and get started, I have already gathered my supplies. Obviously you need your wheelchair. You need some non-slip socks, or if your patient has shoes, that's fine. You need a gait belt. You need some sort of a draw sheet or something to cover their legs just to protect their privacy. You need a gown, which is going to serve as a robe. And then you also need some sort of a pad for the chair. And for this, I just used a cloth chucks. All right? So lots of supplies that you need before you get started. All right, we'll start with opening procedures. Knock, knock, knock. Hi, my name is Jenny. I'm going to be your CNA today. I'm going to go ahead and wash my hands. I'm going to provide you with some privacy. Can I have your name and date of birth, please?
12/21/92.
Pam Farrell.
Pam Farrell.
Yeah, very good, very good. All right, excellent. Miss Farrell, today I'm going to go ahead and get you up to the wheelchair. Okay? All right, side note. When you do this skill, this is a really long skill. I want you to think of it in 3 steps. Okay, step number 1, you're going to set up your room. Step number 2, you're actually getting your patient to the wheelchair, like from the bed to the wheelchair. And step number 3, you are leaving her in the wheelchair, okay? So we're going to go ahead and do step number 1, which is setting up the room. Okay, Miss Farrell, I'm going to go ahead and just shift things over a little bit here so I can get you situated. All right. I'm going to move this out. We want to make sure that your wheelchair is facing the foot of the bed. All right. Very good. All right, wheelchair has to be locked. Critical skill, has to be locked. You need to move your feet out of the way. I'm just going to go ahead and take this one off. And for the other one, I'm just going to shift it. If you guys get this skill, make sure you know how to work your wheelchair legs. It's really important. You'll get really frustrated if you don't know how to work them when you're testing. All right. All right, so my room is set up, ready to go. All right, Miss Farrell, I'm going to go ahead, and the next thing we're going to do is we're going to get you shifted over to the side of the bed. All right. Before we do that, I want to make sure you do not slip. So I'm going to go ahead and put some non-slip socks on you. Good job. All right. Very good. Okay, so we're going to shift you to the side of the bed. When you sit on the edge, make sure you don't feel dizzy. If you feel dizzy, you let me know right away, and your feet have to be flat on the floor.
Okay.
All right? We're going to go ahead and go on the count of 3. Ready? 1, 2, 3. Very good. You feel dizzy at all?
Nope.
Good. I see your feet are flat on the floor. I'm going to go ahead and put a gown on you backwards because it's going to serve as a robe and just to protect your privacy. Thank you. Good job. All right, next thing I'm going to do is put a gait belt. Remember from our gait belt skill, it's really important that the gait belt goes on correctly, okay? How do you know it's correctly, or it's on correctly? The teeth have to be facing you and they have to be out, okay? So this is the correct way to apply the gait belt. If you do it like this, that's not correct because even though the teeth are facing me, they're facing this way. We don't want to do that. Teeth have to be facing me and they have to be facing out. And of course, we're going to make sure that there's no wrinkles in our patient. All right. Is that too tight?
Nope.
Good job. All right, perfect. All right, that's nice and good. We have just about 2 finger widths, which is what we want. All right, Miss Farrell, I see that your feet are flat on the floor. I also see that your bed is locked. On the count of 3, I'm going to have you push your hands on the bed. You're going to stand up on the count of 3. We're going to pivot. Don't hold on to me, just stand up. When you feel your legs touching the back of the wheelchair, then you can sit down, reach back, and sit down.
Okay.
Okay? All righty. 1, 2, 3. Good job. Go ahead and pivot down and have a seat for me. Feel dizzy at all?
Nope.
All right, wonderful. As soon as you get her in the chair, go ahead and get that gait belt off. All right, thank you so much. Go ahead and get your feet up here. I'm going to wheel you out just a second, just so I have room to put the foot on this one. Make sure she's locked. Okay. With this right here, so we're going to go ahead and make sure we can line up our holes, and we use that by opening up this little lever. Every wheelchair is different. You have to play with yours. Good job. Put that there. Get it back straight. All right, last thing I'm going to do is protect her privacy. Very good. All right, are you comfortable?
Mm-hmm.
All right, let's go ahead and get you all the stuff that you need. Oops. Let's knock that over. All right. Here's your water and your tissues. Let me make sure you have your call light that you can reach. Oh. Pretend that extends. Can you reach that okay?
Yeah.
Okay, very good, very good. All right. I know that your wheelchair is locked, which is good. Would you like your curtain to open or close?
How do yours?
All right, very good. I'm going to go ahead and wash my hands, and I'm going to take the gait belt out with me. Call me if you need me.
Okay.